Did you know that infants with genetic disorders contribute considerably to the mortality rate in newborn intensive care units? Genetic disorders occur when mutations or a harmful change to a gene are inherited from the parents and are present in an individual at birth. Genes are made up of deoxyribonucleic acid, or DNA, which contains detailed instructions for cellular functioning and characteristics that makes a person unique. Everyone inherits half their genes from each biological parent and may inherit a gene mutation from one parent or both. A change in the genes due to issues within the DNA, or mutations, can increase your risk of having a genetic disorder. The symptoms of the genetic disorder can arise in a child before or at birth, or these symptoms can develop over time as the child gets older. A few common genetic disorders that you may have heard of are Down syndrome or trisomy 21, cystic fibrosis, or sickle cell disease. As for 16-month-old Ayla, the genetic disorder that she was predisposed to before birth was called Pompe disease. Ayla, a toddler from Ottawa, Ontario, Canada, inherited Pompe disease from her parents. Both her parents were carriers of the mutated recessive gene and passed it on to 3 of their children. This means that both of Ayla's parents have had the chance to pass on the gene to their offspring, but since it's recessive, both of their parents must pass it on for the trait to appear in their baby. Unfortunately, Pompe disease ended the lives of Ayla's 2 sisters. Ayla's parents were devastated when the prenatal test showed that she too inherited the same deadly gene. Therefore, in 2021, while Ayla was still a fetus, in utero experimental treatment was performed. This meant that treatment was given to Ayla within the uterus when she was still a fetus to try and minimize the symptoms of Pompe. So what is Pompe disease? Pompe disease is a rare and deadly muscle disorder. A child must inherit the defective gene for an enzyme called acid alpha-glucosidase, or GAA for short, which breaks down glycogen, which is the form of starch. GAA breaks down glycogen in our cell's lysosome. The lysosome is a cellular organelle that contains digestive enzymes and is responsible for breaking down materials inside the cell. Individuals with Pompe disease have a defective GAA, which means that it codes for enzymes that are unable to break down glycogen, causing it to build up in the lysosome. This accumulation of glycogen severely damages cardiac and skeletal muscles, which causes an enlarged heart and muscle weakness, which is lethal in a developing fetus. Some symptoms of Pompe disease include muscle weakness, breathing problems, an enlarged tongue, liver, and/or heart. Enzyme replacement therapy is when an artificial version of the defective enzyme is infused into an individual through an IV drip. The replacement enzyme is administered directly into the bloodstream through a controlled drip of fluid. For Pompe disease, this means that a synthetic version of GAA is infused via an IV drip every week starting from when a person is born or from when the disease is discovered. However, this option can be very costly and time-consuming. Therefore, researchers have been looking into other treatment options, such as in utero treatment. In utero treatment is typically performed on an unborn baby or fetus in the uterus to help improve the long-term outcome of a child with specific birth defects that may worsen as the baby develops. In utero is performed by using ultrasound technology to view the fetus in the uterus of the mother. Then tools are used to guide needles into the umbilical cord of the baby to inject required material into the baby's system. From Pompe disease, the artificial GAA enzymes would be incorporated into the baby's bloodstream. This would allow for there to be proper GAA in the baby's body to break down glycogen into glucose in the heart and muscles to prevent enlargement or weakness. This treatment targets the main issue and may seem very effective. However, this surgery is very invasive and poses many risks to both the mother and the unborn baby. The surgery could cause uterine rupture or the rupturing of the uterus. There may be operative complications, early labor, fetal death, or the potential failure to treat the birth defect. Even with all these potential risks, Ayla's parents knew they had to try everything they could to save her. In 2021, Ayla's mother was given 6 infusions using in utero treatment between the 24th and 37 weeks of her pregnancy. The GAA enzyme was delivered into the fetal umbilical cord vein using needles guided by ultrasound imaging. Researchers and doctors were hoping that providing artificial GAA enzymes in the developing fetus may help train the still developing immune system to accept the synthetic protein. Therefore, the enzymes would be able to reach the brain more readily to be encoded into proteins that will help break down glycogen into glucose in the heart and muscles. In utero treatment targets the main issue of the defective GAA enzyme before birth, which would help normalize the fetal and early child development while preventing the onset of Pompe symptoms. To everyone's surprise, in utero treatment worked, and Ayla was born with normal heart and muscle development. There were also no problems to the mother or fetus throughout Ayla's treatment. So what does this mean for the future of treating genetic disorders? Well, Ayla has taught the world that it's possible to diagnose and treat a fetus before birth. This opens a new chapter in fetal therapy where doctors can potentially treat and cure fetuses with other genetic diseases. It targets the disease before it even begins to develop. Therefore, it's super important for families to genetically screen their fetus when genetic mutations can be picked up on. Thanks to Ayla, doctors now know that there are ways we can save lives even before birth.